Hello, and welcome to the first lecture in the Epidemics and Outbreaks course. Epidemiology is a science that affects all of us every day of our lives. We shop for food with little regard to or worry about whether what we purchase and eat is safe. And for many of us, smallpox, polio, plague, diphtheria, and cholera are diseases that either we've never heard of or we do not give much thought or attention to. So this course is intended to inform you about the vital role of epidemiology in enhancing the health of individuals and communities. It will help you understand and read epidemiological studies and to understand the global effects of epidemiologic research. Epidemiology as a discipline provides a framework of methods and principles from which information can be reviewed and analyzed in a way that public health problems can be identified and addressed. And learning to think epidemiologically empowers you with a way to understand and explore the world in which you live. It develops your scientific, mathematical, health, and media literacy and allows you to make more informed personal decisions. And it's also really, really exciting. So many people have heard the term, but few really understand what it is, what it does, and how it influences our daily lives. So what exactly is epidemiology? The classic definition that has been widely accepted in the field is that epidemiology is the study of the distribution and determinants of health and disease in populations to enable health services to be planned rationally, disease surveillance to be carried out, and preventive and control programs to be implemented and evaluated. So what exactly do we mean by distribution of disease? The underlying premise of epidemiology is that disease and illness are not randomly distributed in populations, but rather each of us possesses certain characteristics that may increase or decrease our risk for developing a variety of diseases. These characteristics may be genetic in origin, or they may be the result of environmental exposures, or they may be the result of something else entirely. So we need to first identify patterns in health and disease and then figure out what explains these patterns. So determinants then refer to the factors or events that are capable of bringing about a change in health. Determinants can be broadly characterized as biologic, chemical, lifestyle, or social. Biologic agents are bacteria or viruses that cause disease. Chemical agents are things like tobacco smoke, which is a known carcinogen. Lifestyle factors are things like alcohol, diet, stress, sleep quality, all these things that influence health. And then lastly, social factors are defined as the conditions in which people are born, grow, live, work, and age that also impact health. So in epidemiology, we want to identify diseases in populations and understand why these diseases exist. So we might start by looking at the distribution of a specific exposure and the relationship between that exposure to a specific disease. So in this graph, you could imagine that maybe the blue colors express different distributions of exposures and the green are different diseases. And so, for example, we may want to look at the relationship between a specific dietary pattern, such as vegetarianism, and the incidence of colon cancer. So there are many different ways of doing this, and we'll get to this in the second part of the class. But once we make a connection between a disease and a genetic, environmental, or behavioral risk factor, then we can plan and develop interventions to prevent disease and promote health. So this is how epidemiology touches our lives in a positive way every day. So epidemiology is often called the basic science of public health. And this is because it can help us figure out what causes disease, how disease is spread, how we can prevent disease, and what works in controlling disease once an outbreak has started. So epidemiology is a tool for public health action so that we can promote and protect the public's health. And we use science, causal reasoning, and a dose of common sense. There are two main types of epidemiology. The first is descriptive epidemiology, and the second is analytic epidemiology. Descriptive epidemiology examines the distribution of a disease in a population and observes the basic features of its distribution in terms of person, place, and time. So descriptive epidemiology is focused primarily on survey designs, cross-sectional studies, descriptive studies, and asks the questions what, who, when, and where. Analytic epi, on the other hand, involves testing a specific hypothesis by conducting an epidemiologic study that relates the exposure to the disease of interest. So the key feature of analytic epidemiology is there's a comparison group. So we figure out the patterns in the descriptive epidemiology, and then in analytic epidemiology, we test the hypothesis that was generated from the descriptive epi. And these designs are typically cohort studies, case control studies, clinical trials, and we'll go through all of the different study designs later in the course. And these analytic epidemiology answers the questions why and how. Okay, so knowledge of the epidemiological situation around the world is essential for public health policies and programs. First, old diseases are constantly reappearing. Diseases such as Ebola, smallpox, and pertussis are making a comeback because vaccination rates have declined, specifically for pertussis. And secondly, we have several examples of newly emerging diseases such as SARS and Ebola. Last, we are battling modern epidemics such as obesity, smoking, and violence, all of which have intensified the need for up-to-date epidemiological surveillance. The WHO, or the World Health Organization, estimates that by 2030, more than 75% of all deaths will be from chronic and non-communicable diseases. Throughout the world, vulnerable and socially disadvantaged people get sicker and die earlier than people in more privileged social positions. Epidemiology helps us figure out what causes illness and disease, and it helps us evaluate interventions that are designed to reduce morbidity and mortality around the world. So let's talk for just a minute about some specific examples of how epidemiology has made major contributions to improving population health. There are just a few examples listed in this slide, and there are many, many more that I could have listed that just can't fit on the table. The global eradication of smallpox may be one of the greatest achievements of public health and medicine. Smallpox is a serious, contagious, and often fatal infectious disease. And in the past, it killed almost 30% of infected people, and those who survived had scars. So when Edward Jenner introduced the smallpox vaccine in 1949, the last naturally occurring case in the world was in Somalia in 1977. Another interesting example is an identification of the relationship between smoking and lung cancer. If you think back to 1965, almost 50% of men in the U.S. were smokers. Today, that number has been cut to almost 25% through hard work focused on epidemiology, health education, and public policies, such as labels with health warnings and taxation. Another interesting example is that we have discovered that viruses can cause cancer, one of the prime examples being HPV and cervical cancer. So this epidemiologic discovery led to an HPV vaccine for cervical cancer prevention. So public health continues to make major achievements by controlling epidemics, providing safe food and water, and establishing preventive health services. So that leads us to the objectives of epidemiology. The main objectives are first to investigate the etiology of disease and modes of disease transmission. Secondly, we look at trying to determine the extent of disease problems in the community. Third, studying the natural history and prognosis of disease. Fourth, evaluating both existing and new preventive and therapeutic measures and modes of healthcare delivery. So this could be a new drug that's better than an existing drug. This could be a new way of delivering healthcare, maybe through nurse healthcare aides instead of registered nurses. Lastly, providing a foundation for developing public health policy and regulatory decisions. So we said earlier that the goal of epidemiology was to identify and prevent factors that lead to disease in populations. The dynamics of disease transmission involve a complex interaction of disease-causing agents, things like bacteria, viruses, chemicals, physical agents, could be trauma or radiation, nutritional agents, and the interaction of these agents with the environment and the host or intrinsic factors. And some examples of environmental factors include things like temperature, crowding, neighborhood, water, and air pollution. And on the host side of things, we can look at variation in disease outbreaks by demographics, genetics, occupation, immune status, social conditions. And so there's a complex interaction between the host agent and environment, and this interaction may change over time, which also increases the complexity. There are several key defining features of epidemiology. Epidemiology is sometimes referred to as population medicine, and this is because the key focus of epidemiology is populations. Populations refer to a collection of individuals who share one or more observable personal characteristics from which data can be collected or evaluated. So we're not only interested in why certain individuals have higher risks of disease, but also why certain populations have more disease than other populations. It's also important to remember that populations differ, and populations can be divided into subpopulations based on many factors, including demographics. These subpopulations will have different healthcare needs and will use healthcare services in different ways. Secondly, epidemiology involves measurement or quantification. Epidemiology measures often require counting the number of cases of disease. Disease distributions are frequently examined according to person, place, and time. Third, epidemiologic studies involve comparison. Disease distributions are examined according to demographic variables such as age, sex, and race. And last, epidemiology is an interdisciplinary field that draws from biostatistics and the social and behavioral sciences, as well as from medically related fields of toxicology, pathology, virology, genetics, microbiology. Okay, so when we talk about epidemiology, many people think of causality. And it is true that causality is a central concern of epidemiology, but it's also a very complex subject. And risk can be viewed from many different perspectives. A statistician might see risk in terms of the probability of a certain outcome under conditions of uncertainty. A biologist might see risk in terms of biochemical and immunologic systems that promote disease causation or provide immunity. Social scientists might see risk in terms of the social structures and history that affect personal decisions and access to resources that are important for shaping life's events. An epidemiologist would embrace all of these views, seeing risk as the funnel through which a complex set of causes results, or not, in a given outcome. So epidemiology is based on the premise that a cause produces risk, and this risk increases the rate of appearance of cases of a phenomenon among those exposed as compared with those who are not exposed to the cause. And so by comparing the rates of cases in exposed and unexposed populations, we can figure out differences in risk and then suggest both the cause or causes and mechanisms through which the cause creates the risk. Understanding the cause and the mechanism through which it operates allows the design of interventions for prevention, as well as the testing of the effectiveness of those strategies. So most of us, if we watch the news, we see these causal claims all of the time. The media love to report on causal differences produced by epidemiological studies. And so you may see something like drinking too much coffee can kill you. So a new study results that reports that 4 cups a day is harmful. And then the next week, another study says coffee and tea lowers the risk of diabetes. So all of these conflicting studies can leave us as health consumers very confused. But many times, what is seemingly contradictory reports actually provides an epidemiologist with a lot of clues as to what might be going on. So different studies differ in dosages that are used in the study, geographic regions, the demographic characteristics of the group of participants. And so all of these differences might give us clues as to what's going on. So for example, if we see that a nutrient study has a positive finding in women and a negative finding in men, we might be able to hypothesize that there's some sort of hormone involved in the nutrient metabolism of that particular drug or nutritional factor. And so what's actually seemingly contradictory, if you dig a little deeper, it's all part of the scientific process. And that's not to say there are not bad studies out there, because there definitely are bad studies out there. But for the most part, the majority of these conflicting information is actually very important. Okay, so to put the field of epidemiology in perspective, I think it's helpful to highlight just a few of the important historical events that have led to the development of the field. The notion of survival of the fittest can be extended to assume that early humans acquired over time an understanding of the relationship between environment and health. Food and water that made people sick was no longer consumed. So Hippocrates was considered by many to be the world's first epidemiologist. He wrote a classic work entitled On Airs, Waters, and Places, and explained why epidemics and plagues happened. During the Middle Ages, the interest in epidemiology shifted from environmental factors to understanding specific causes of disease. For example, what was in a mosquito bite that resulted in disease? And this work was largely due to John Grant. He was a statistician who used empirical observations of causes of death and compiled the first mortality tables. He was able to classify and categorize death and then noted patterns about the mortality rates. Some of his interesting observations included higher mortality for men versus women, seasonal variation in death rates, and high infant mortality rates as compared to older ages. And his work provided the foundation for what we now know as our modern vital statistics system. In the 18th century, Edward Jenner, who was a doctor in rural England, discovered that immunity to smallpox could be produced by inoculating a person with material from a cowpox lesion. Cowpox is a pox virus in the same family as variola. And so Jenner called the material that he used for his inoculation vaccine from the root word vacca for cow. The procedure was much safer than variolation, which was a common procedure that was done at the time, and it involved scratching material from an actual smallpox lesion into the skin of someone else, and it could result in severe disease. And so vaccination to prevent smallpox was soon practiced all over the world, and smallpox was subsequently eradicated. So in the 19th century, we have Dr. John Snow, who's an English physician and anesthesiologist, not the Jon Snow from the Game of Thrones. So John Snow began studying the cholera epidemic in London during the 19th century. He investigated a famous cholera outbreak that occurred in the mid-19th century in Broad Street, Golden Square, London. So he believed that cholera was transmitted by contaminated water and was able to demonstrate this association. If you go to London today, you can see the John Snow pub and a replica of the Broad Street pump. So the John Snow story is a fascinating story of how scientific evidence can be used to support theories, hypotheses, and analytical investigations. In 1854, London was the biggest city in the world. There were 2.5 million people. They had a major problem with how to manage a large population size and disposal of waste. And John Snow was trying to make sense of patterns that were happening in the city, and then try to connect them with patterns and behavior happening on a microscopic scale that he can't even see. So it's a crucial element to the story. He can't see the bacteria. He has to infer it from the patterns he's detecting in the streets of London. And so in London at this time, there were two different water companies that supplied water from the Thames River to houses in the same area. And in that 1852, one of the water companies relocated their water pump to a less polluted portion of the river. And so John Snow's theory that polluted drinking water was the cause of transmission of disease was confirmed when he mapped all of the cholera deaths with the source of the victim's drinking water. And then after his investigation, the pump with the contaminated water was removed and the outbreak stopped, making him a local hero. So his contributions were critical to epidemiology for a number of reasons. One, he hypothesized that cholera was a waterborne infectious disease, which at the time was a very revolutionary theory. He mapped the geographic distribution of cholera cases. So these spot maps, this was the first time that anything like that had ever been used. Third, and probably the most important, he collected data on drinking water habits of those who were affected and those who were unaffected so that he could have a comparison group. So this is critical to epidemiology. And then last, he recommended a public health measure to prevent the disease, and that was the removal of the water source. As the 20th century began, epidemiology was involved with infectious and communicable diseases. As the century progressed, chronic disease became more pronounced, and epidemiologists began to study tobacco use and its long-term health effects. In the 1960s, the Surgeon General reported on the relationship between smoking and heart disease in a landmark publication. A number of other major landmark cohort studies were started in the mid-1950s. And the Framingham study is one example of a cohort study that's still ongoing, and it's provided most of what we now know about heart disease. In the 21st century, epidemiology expanded its focus to health status, health-related quality of life, and the burden of disease. So there's more of a shift on sort of the quality of life. In addition, the results of 9/11 resulted in epidemiology gaining a role in bioterrorism preparedness and the management of healthcare services. The infectious disease focus also became important, again, owing to a significant number of emerging infectious diseases, including SARS, H1N1, and Ebola. So just to sum up, we talked about the definition and uses of epidemiology. We also discussed how the field has expanded from primarily the study of infectious diseases to a field of the study of complex methods to study chronic diseases, environmental and occupational conditions that affect health, and bioterrorism. You may also be interested to know that Forbes magazine recently published an article on the most meaningful jobs, and epidemiology ranked in the top 25. So the field of public health is very exciting, and most epidemiologists take great satisfaction in knowing that they're doing their part to improve the health of those around them.